welcome everyone. Today's topic here at Health Buddha is all about unlocking fertility. So we're going to be talking about the power of nutrigenomic testing for personalized preconception care. I'm Dr. Danielle O'Connor. I'm a naturopathic doctor, and I'm really excited about this topic. So really, for those embarking on the journey of parenthood, it can be very difficult to know what is the best individual approach to optimize your fertility and really ensure a healthy pregnancy. So today we're going to be taking a deep dive into the realm of nutrigenomic testing and its potential as a groundbreaking tool to individualize preconception treatment, offering valuable opportunities to optimize fertility and really ensure that healthy pregnancy. This discussion is led by a distinguished panel of fertility-specific naturopathic doctors and nutrigenomic researchers. This webinar really aims to provide a comprehensive understanding of the scientific principles of underpinning this personalized approach. We'll look into the correlation between genetic markers and their influence on fertility, enabling a personalized approach to preconception plans. So I'm so happy to have Dr. Robyn Murphy, naturopathic doctor, here today, as well as Dr. Jennifer Fitzgerald, naturopathic doctor. So welcome. Thank you so much for being here. I'm actually going to pass the mic over to the both of you to introduce yourselves, tell us a little bit about the clinic that you're working at, and just really what you're putting your time into right now. Obviously, you are our fertility specific naturopathic doctors that we have here, as well as nutrigenomic researchers. But I'll pass it over first to Dr. Jennifer Fitzgerald, naturopathic doctor, to open it up a little bit here.
Great. Well, thanks for having us today. We're really excited to be here. As you said, I'm Dr. Jennifer Fitzgerald. I'm a naturopathic doctor. And several years ago in 2011, I co-founded a clinic called Conceive Health. And at that time, we grouped up with a group of fertility clinics, an IVF clinic. And we started an integrative program in order to really sort of embrace preconception care in the fertility clinic setting. And so that model was successful, and we have expanded that over the last number of years. And now we have 7 different locations in Ontario in different fertility clinic settings. And so that has obviously opened the door to a lot of integrative cases and a lot of cross collaborations in terms of research and things like that, and has really just sort of widened our area of expertise and knowledge of working with fertility patients. So I think that is sort of what kickstarted this next project, which was a couple of years ago. We co-founded a company called FernDNA, and that is a nutrigenomics test company, which looks at SNPs or single nucleotide polymorphisms through the lens of reproductive health. And so this is our latest and greatest project, and really, trying to integrate that into the clinical setting and help our patients be even more individualized in their treatment goals is where that's going. And so I'll let Robyn introduce herself before we get into all of that good stuff.
Thanks, Jen. So I'm Dr. Robyn Murphy. I'm a naturopathic doctor, and I'm working at Conceive Health, but I also have a lot of other roles. So I'm a scientific advisor for DNA Labs, and I've also been a collaborator and fellow nerd for FernDNA. So I spend a lot of my time doing research, looking at different genes and how they can impact certain pathways that impact fertility, different conditions that we know that will impact fertility, and then how we can utilize that information for individualized care. So I love bringing the research aspect of it with the clinical aspect and supporting patients along their way.
Amazing. Well, welcome. Thank you again so much for being here. And let's really get started, because There's so much information here, and I really want to start off with some general information in the sense of, like a lot of people may not be very familiar really with what nutrigenomic testing is, what that really means in general, as well as that testing approach really in the context of fertility and preconception care and what that means, right? So, Dr. Robyn, if you can go into that just in terms of general terms so that everybody can get an idea on that concept, that would be fantastic. Thank you.
Yeah, I think we're using a lot of big words here. And so let's break it down. And first of all, when we talk about preconception, this is the period before fertilization. So it's roughly about 3 months as the egg and the sperm are fully maturizing or maturing. And we know that the lifestyle, dietary supplements have an impact on that process. And so that's where we like to do our upfront work. We see that it will impact the timing of conception, the health of embryos when we're doing, say, IVF, as well as the health of the pregnancy. And so in fertility, you'll see a lot of different types of genetic tests that are offered. There's chromosomal tests that are done, and this is actually looking at the number of chromosomes. Normally we have 23 pairs, so we should have 46. But in certain diseases, you'll see that there's the wrong number, and that can lead to conditions like Down syndrome. So that can be tested. Actually, the embryo can be tested. There's nothing we can do once the chromosomes end up, dividing and making up that cell. There's nothing we can do once that has occurred. There's also pre-genetic testing that's done for different types of genetic diseases. Or as I mentioned, the number of chromosomes is called aneuploidy. Again, there's nothing we can do with that information except know whether or not it's a healthy embryo and we want to actually implant it. When we talk about nutrigenomic testing, so we're looking at genes, but we're looking at genes that have to do with certain cellular processes that affect nutrients, and they affect how we respond to nutrients or dietary interventions. And we see with these pathways that they will actually influence different conditions that we see will impact fertility. So how we're utilizing this information is these genes, everybody has these genes, everybody has these changes in these genes. And what we identify with research is that these are the changes that help us to understand why we can give the same diet to 2 different people, and one person does great on it and the other person no change. So say if we're looking for diabetes or we're looking for weight loss, some people respond really well. And, the researchers went back and say, what's the difference here? Well, it has to do with, a lot of it is our genetics. So we're looking at these pathways in relationship to fertility.
Yeah, that's great information just in terms of really letting people know what that nutrigenomic testing is versus genetic testing, right? And maybe I'll pass the mic over to Dr. Jen in the sense of really elaborating on how those nutrigenomic insights really help healthcare providers such as you and Dr. Robyn to create those personalized plans, really preconception plans for people that are looking to enhance that fertility journey.
Yeah, absolutely. So, I mean, if I can think of probably 10 common questions that I get clinically from patients all the time. What prenatal should I take? What should I be eating when I'm trying to get pregnant, or when I'm pregnant, or when I'm going through an embryo transfer? And so we can all say, like, we should take a prenatal vitamin, but what does that actually mean? And as the 3 of us are well aware, and probably everybody that's listening, there's at least 100 different prenatal vitamins on the market. So which one of them are we supposed to pick? And so they all will have the basics, some type of folate source, some type of iron, usually some type of vitamin D, but they might vary in terms of the type or the bioavailability or the dosage amount that's in that particular formula. So that's sort of how I kind of look at, which one do we need is based on our individual needs. Our diet is going to be different. Our lifestyle is going to be different. Our environment even might be different. And then our genetics are different. So we can't all necessarily utilize the same things in the same way. And Robyn said it well when she said that, if we give two people the same diet, one does well, one doesn't. It's the same with every type of medication, vitamin, nutrient, everything like that. So if we look through the lens of, our basic prenatals, we hear a lot about folic acid versus folate. It depends on our genetics. How much vitamin D do we need? We hear 1,000 from Health Canada. Half the doctors are saying 2,000. The other half are saying 4,000. Again, that kind of comes down to our genetics and how our body is able to absorb, transport, or metabolize those specific nutrients. So that's how I tend to use a lot of this information clinically is, which prenatal are we going to use? What diet is going to be the best for your preconception journey? Do you have genetic predispositions to endometriosis or PCOS or another condition that's going to negatively affect fertility or pregnancy, for example? So those are the real obvious ones I think that I use. And then I think there's, a lot of interesting things and patterns that we've seen clinically over the years that we can get into more complicated stuff like implantation failures and pregnancy losses and things like that.
Yeah, that's some great information in terms of even like that personalized approach with prenatal vitamins, like you were saying. So it's not that, there's one prenatal vitamin for every single person across the board and that everybody should be just taking the same thing. And I really do love how this information with the nutrigenomic testing is going to give like really that personalized approach, and obviously working, with your healthcare provider that can understand this information, right? So maybe we'll dive a little bit deeper now, now that we have like a broad perspective on what this means. Maybe Dr. Robyn, you can take us a little bit deeper in terms of, what are some of those key genetic markers that have been identified to influence fertility? How can we look at these markers and take that knowledge and then translate it into, whether it be like lifestyle factors or, dietary factors, supplement factors in terms of what you're doing with your patients. So yeah, if you can give us some information on what that entails really.
Yeah, I can kind of split it into kind of two different categories. I think the diet, nutrients, and understanding how the genes, they are producing these proteins and enzymes, which are essentially for all of our nutrients, will influence how we digest them, how we absorb them, how we transport them, how we take them up into the cell, how we metabolize them. We don't think of all of these processes that happen in the body when we take a vitamin or eat our food. So each of those steps can be influenced by our genetics. And some of the big players, people may come across or have heard of MTHFR. This is a gene that has gotten a lot of notoriety. And the reason is because it's involved in DNA synthesis and repair. So every single cell that is creating DNA can effectively be impacted by this. And that's why you see so many connections to all these different chronic diseases and conditions. But it helps us to understand some people have a 75% reduction in enzyme efficiency of this. And so we know that it can influence how effectively they take folic acid or folate and turn it into the active form, which is methylfolate. And this is part of a whole pathway. So we not only give methylfolate, this will help us to say the dose as well as the amount or form, but we'll give all the nutrients and vitamins to support this pathway. Another big one that I see in fertility is choline, which is very much often forgotten until the second and third trimester. So this is actually part of that same pathway that's involved in folate. So this one I see come up very often for women and also for men too. It increases likelihood of non-alcoholic fatty liver disease. So in men, so it's important to, especially if liver enzymes have been high, this is a relatively easy treatment that can be implemented early on and prevent liver damage later on. And I would say also that another key one that I come across, which is very interesting and in a very subtype of population, is histamine. So histamine intolerance, allergy symptoms. There is some connection with implantation failure and pregnancy loss. So that's something that will kind of cue us in on our radar that this is something we need to ask more questions about for patients. The other side of it are getting into the nitty-gritty and getting into genes that will actually impact different conditions that have been associated with infertility. So we see genes within the liver. It's part of a glutathione pathway. So essentially the liver, we have these enzymes all over our body, and they're taking antioxidants and they're binding them to toxic compounds. And what it's doing is it's helping to reduce the likelihood that that compound will actually damage the DNA, the proteins, the fats within our cells. And we can kind of think of this like protecting our cells. And when we talk about gametes, we talk about eggs and sperm. These are highly sensitive little cells, right? They're very sensitive to the environment. And so what we see is these genes, they're called GSTs, people can be missing them. And so what we've come across is a higher link of these genes to endometriosis. We see a direct correlation with male factor infertility. When we talk about these from a longevity standpoint, we also see increased likelihood of cardiovascular disease. So the same processes that are actually impacting fertility go on to impact our cardiovascular health, our metabolic health, our neurological health. And so we know that these genes, the impact that they're having is increasing oxidative stress or damage to the cells. And they're also increasing susceptibility to environmental toxins. So this is something that we don't really have a test, a blood test or anything available that we do on a regular screening profile in a fertility clinic. So this has really been, I would say, informative when we look at patients, especially the patients who are diagnosed as idiopathic infertility. So we've done all the tests, everything comes back normal, and then there's no real reason why they're not getting pregnant. That can be pretty frustrating for patients. So I think that's a big one. And, you know, I could go on about all of the genes in this panel, but I think for time's sake, I'll end it there.
Yeah, wonderful. No, that's great. And I really do love how you have pinpointed a lot of those genes. So it truly is that personalized approach, right? Everybody's plans are going to be different because it's based on your genes, and all of our genes are different, right? So yeah, I think this really is cutting edge testing that a lot of fertility clinics obviously, you know, aren't really diving into this yet. So I think this is great information to be getting out there, just really letting people know that this type of testing is being offered. So I'll switch over to Dr. Jen here, because I want to hear a little bit about, you know, like your experience as a naturopathic doctor. You know, you're using this nutrigenomic testing and obviously helping individuals and couples with their specific fertility needs, right? So can you kind of give us some information just on how this testing has helped with, you know, successful conception and healthy pregnancy?
Yeah, sure. I mean, it's interesting because sometimes, you know, I get patients that are just starting out and we use this type of thing to guide us in terms of like what they might need, you know, at the beginning of their journey, and we see them being successful from the beginning. But other times we're seeing people that have failed multiple times over and over and over again. And I think that's usually where I see like the most profound changes in some of these people. Robyn mentioned a few really key genes that I look out for all the time. So for example, I remember this one specific individual. It was a male, and he had very, very high DNA fragmentation on his semen analysis, which is a test that's performed to sort of measure the viability of the DNA in the sperm. And so a high fragmentation rate means that it's not a very good prognosis to create an embryo with that particular sample. And so the treatment strategy is usually to give antioxidants for 3 months, and then we retest. And honestly, like 99% of the time, 9 times out of 10, that number goes down and everybody's happy and we move on. But it wasn't budging, and it was really high. And we only see this a handful of times, I would say, where we don't see those numbers we're improving with treatment. But one of the really interesting things that's come out in research in the last few years is the GST gene that Robyn was referring to, and individuals that have what we call the GST null genotype. So they are actually like completely missing these genes, or they have gene deletions. They can't utilize these antioxidants in the same way, meaning they can't make glutathione in the same way as other people. And so we can give all the antioxidants in the sun potentially, and it's not necessarily going to help if we don't give the right ones. And so I think that's a classic example of we can treat and treat and treat and treat and treat, and CoQ10 works for everybody, doesn't it? But no, it does not. And so, you know, it's number one, identifying that and knowing that maybe there's something that we can do, and altering the treatment protocol and trying that. And then also on the other flip side is sometimes there's not actually something that we can do about these things. And that's a good thing to know too, because that helps us make educated decisions and not waste a ton of time. So in this particular example, after, you know, several attempts and trying to decrease this number, this couple moved on and did donor sperm and got pregnant on their first cycle. After years of trying. So, you know, knowledge is power sometimes when it comes to things like that. The other things that I think of is really poor egg quality. Sometimes that is really unexpected. So we see, you know, healthy women, they're not, you know, of good reproductive age, their antral follicle count is good. There's no really signs of anything abnormal. And then they do an IVF cycle, and the egg quality is poor, or the embryo quality is very, very poor, and there's no clear cause. That's where I find this can be very, very helpful as well. So again, a few things that Robyn said is sometimes when our hormones are high, which they're really high during an IVF cycle, it kind of can create a bit of a perfect storm that we can put a little bit of extra oxidative stress on those developing eggs at the wrong time. And so if we know about that and we can be proactive and protect those follicles, say during that cycle, we can have a much better outcome, or we can actually use that information to modify the cycle or the medication protocol, which is another favorite trick that we can do. So this type of testing not only works for nutraceuticals and vitamins and dietary stuff sometimes, but also through the lens of, you know, how our hormones might behave, and even sometimes how medications can behave.
Mm-hmm. Yeah, that's really interesting. So I almost want to take, you know, that information that you kind of went into a little bit deeper into some specific like case studies or stories that you may have. And I know you did mention a little bit, but, you know, can you give us an example of like a case study where, you know, targeted supplements really based on this testing in terms of the nutrigenomic findings, where they played a pivotal role in, you know, supporting fertility outcomes, really?
For sure. Yeah. I'm going to try to go through 2 really quick stories for you, just because I think they're both really, really interesting, and they're kind of 2 completely different circumstances. So the first one was a 35-year-old female, and she was not doing fertility treatment. In fact, she was trying to conceive on her own, and she easily conceived twice in a row and miscarried both times. And so, you know, that can be something that needs a lot of investigation. And so she came in for a workup before she went to a fertility clinic because the wait list was very long. And so we had a lot of conversations, and she wanted to be really proactive. And so we did my basic lab workup, but we also, she had also come in with Nutrigenomic testing that she had already done, which was really, really helpful in guiding the treatment. So I was able to analyze that report, and it guided me to do some lab work and also make some clinical decisions at that time. So one of the things that we found is that she had hypothyroidism, and she also had like an increased risk of hypothyroidism from a genetic perspective. So we looked at a couple of those different SNPs. And she also had an impaired beta carotene pathway, which is the pathway that breaks beta carotene into vitamin A. And so if we think about vitamin A, has kind of a bad rap from a fertility perspective because high doses of vitamin A in pregnancy are considered to be teratogenic or negative, but we also need vitamin A to stimulate folliculogenesis and embryogenesis. It's a very, very critical nutrient for egg quality and embryo quality. Long story short, she had really high beta carotene and low vitamin A, and that was a result of that pathway. And if we look at most prenatal vitamins, they actually have beta carotene instead of vitamin A. And she was a vegetarian to kick it off, so she doesn't get very many dietary sources of vitamin A. So we swapped that out. We had to give her the vitamin A and take away the beta carotene. There's a few other things. We helped balance her thyroid. We helped, she had an increased risk for things like inflammation. She had a high risk of developing endometriosis based on her detoxification genes. So we supported those things. We had to bring her beta carotene levels down pretty significantly. Then she went on to try again, this time successful, already had her baby. So that was a really cool, easy fix, I thought, based on just a little bit of information from that SNP test. The second example that I have was a much more long chronic case. This was a 34-year-old female, and she had 6 miscarriages. So those miscarriages were all spontaneous conceptions, and they were all miscarried by 8 weeks of gestation. And so at that point, she had done a lot of testing. This was prior to seeing a naturopathic doctor. She did an IVF cycle. They retrieved a bunch of eggs. They fertilized them, and none of them developed into embryos. And so at that point, she came in for naturopathic preconception care. We put her on some preconception stuff. And once again, she had happened to have some nutrigenomic testing done. So we analyzed that as well and found a few things again. So very, very high risk of detoxification issues. She had that GST null situation going on. She was one of our MTHFR homozygous patients, so needing folate. She also required a lot of choline. So I think it was like 900 milligrams of choline that we had her on or something like that, and something along that line. And we also gave her glutathione as instead of N-acetylcysteine, which she had been taking prior to her previous cycle. So she was still on some CoQ10 and other things. She repeated IVF, and this time she got 4 embryos that were sent for genetic testing. She got 2 normal embryos and was pregnant after her first transfer. So that one was like a really good example of how it can improve egg quality on an IVF cycle.
Yeah, that's amazing. And this is also this is information that, you know, with the typical blood panel, people aren't going to know this information, right? Whether, you know, like you said, beta carotene versus vitamin A, or even using glutathione versus NAC. Like, this is really only information that you would be able to get from nutrigenomic testing. So yeah, this is amazing. And I love those you know, stories and case studies, because it really gives that information of how, you know, it can apply to an individual and see those differences in the treatment plan. So last question, I just want to go back to Dr. Robyn. So for individuals that are really considering, you know, starting on a fertility journey, what are those essential steps that they should be taking to undergo, you know, nutrigenomic testing? And then how can they interpret the results, you know, to make informed decisions about their preconception care? If you can let us know what that process is.
Yeah, I think for people, the knowledge around genetic testing is starting to become more prevalent. People are more familiar with this type of testing, but it's still new. So it's important to find a company that is focusing on fertility, first of all, because you are really focusing your efforts in preconception care and fertility. And these genes, they do a number of different things. So You know, it takes training for people to kind of understand this as well as to interpret it. There are tests out there that are pretty, that are written for the public and they can be interpreted, but I would suggest going to a practitioner who has some knowledge around genetic testing or experience with nutrigenetic testing. You can use a Canadian company or US company. Just know some of the privacy agreements around where the data is stored. That's something that I think people should consider. And I've gotten a lot of questions around that, just around privacy and what happens to the genetic information and even the genetic material. So that's something to consider. And I know a lot of practitioners or a lot of patients will kind of take this to their medical doctor or take it to their fertility doctor. They are trained in monogenetic diseases and diagnostic genetics. So just know that they may not understand some of the nutrigenomic side of it. So when you're looking for dietary, supplement, lifestyle modifications, usually going to an integrative practitioner or a naturopathic doctor would be the best person. So a lot of these clinics, a lot of companies will also do 15-minute introductory calls. So I think it's really important to have a good relationship with the person that you're working with. It tends to be at least 3 months, right? If not longer, 9 months, 12 months that you're working with this individual. So you really want to jive with that practitioner and have a good working relationship too. So I suggest just reaching out, calling the clinic, booking a 15-minute introductory call, see what experience they have, if they do nutrigenomic testing or know how to interpret it and how they utilize it in their practice would be some good questions to start with.
Yep, that's great. And I know obviously there's nutrigenomic testing for different needs, whether it's cardiovascular disease, weight loss, you know, a number of different areas. So really also speaking with a practitioner that has a focus on fertility and preconception care. And, you know, this is what you spend all of your time doing, really. So you're really into it. So I think that's very important also. So I just want to say thank you so much. This has been fantastic information. Really appreciate you being here with us at Health Buddha. We will make sure that all of your contact information is available for anybody who's interested in reaching out, you know, to you at Conceive Health. And if they have questions about the testing, how it's interpreted, that type of thing, they can reach out. And again, thank you so much, Dr. Jen, as well as Dr. Robyn, for being here for this discussion today. Really appreciate it.
Thanks so much.
Thanks for having us.